This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Dr. Amelia, today we're going to talk about what women really want, making the most of your sex life after 40, which is exciting.
Yes.
So what do us women 40 plus want sexually and in our relationships in middle-aged? And how can we make the most of this time of our lives?
Well, that's a bit of an interesting question. And my feeling is actually a lot of people out there listening to this may be saying actually very little. But then some other people might be more enthusiastic. So,
yes. Well, if you're Kathy Lett, you want to put the sex into sexagenarian, but that's moving on even further. But
that's Kathy Lett.
Yeah, that's Kathy Lett too.
Yeah.
But the other night, I was watching this appalling movie on Netflix called What Women Want, and it's our Mel Gibson and Helen Hunt. I think
I've seen it.
Yeah.
And it's a little bit old. You're a little bit dating yourself.
No, but it's back. It's back on Netflix, and I watched it again just for old time's sake. But he falls into a bathtub and there's a hairdryer and he gets electrocuted. But that gives him that ability to understand what women are thinking.
Yes, that's right.
But it's interesting because I was thinking the whole premise of the movie is about that guys don't get what women are thinking or want, which is probably fair enough.
Yeah, I was going to say it's kind of okay. Yeah.
But, there's something a bit weird about that when you think, well, that means that women obviously aren't communicating properly to guys.
Well, isn't that a big topic?
Yeah.
Who is going to talk to us about this tricky topic today?
Today we have an expert. Her name is Dr. Margaret Redelman. She's an OAM. She's a medical doctor, accredited as a clinical psychosexual therapist with the Society of Australian Sexologists. So, Margaret Redelman, welcome to She Wasn't Born Yesterday.
Hello.
Margaret, so good to have you on the potty.
Thank you so much. I'm really pleased to be here.
That's good. Well, Margaret, let's just plunge straight into this. What do women really want sexually when we're 40 plus fabulous?
Oh, such a broad question because there isn't one woman. We're all individuals.
Yeah.
Yes.
And I think what we want globally is to be respected and liked as individuals. So there isn't one generic answer that's going to meet everyone because we all live in different circumstances with different backgrounds, different health, different relationships, and different sexualities. We fall on a bell curve. So some women don't want sex, not interested in sex, are very happy to say goodbye to sex at 40 when they've had their kids. And other women are jumping out of their skin, wanting to make love every day, wanting to be sensual. So there isn't one answer that's correct.
Yeah.
We're all individuals. And I think what's really important at 40 and what I see happening is that by 40, women are what we call actualised. They've gone through the insecure teens and 20s. They've gone through the striving and experimenting 30s. And by 40s, I'd be hoping that most women would know who they are and what they want. And at that point, also being secure enough to actually seek what they want. So if where they are isn't good enough, it's actually having the confidence to go out and make it better. So what women want at 40, I think these days, living in this beautiful country of Australia where we have peace, we have facilities, we have help, is actually to make the best of their lives that they can.
Actually, that's quite an exciting message, really, from Margaret there. 40 plus fabulous listeners to this podcast, now is your time.
Now
is your time.
Carpe the hell out of diem. That's another Kathy Lett.
But yes, so from what Margaret's saying, like it is the point at which women often collectively are a bit actualized as, now is the chance for us to actually tune into what we want and actually translate that into asking or discovering.
Yeah, I've heard that like post-menopause, like your actual hormones change so that you do become actually a bit more confident post-menopause. Do you reckon that's correct, Margaret?
It very much depends.
Okay.
If everything is going well in your life, then I think after menopause, a lot of women say, I've done my child rearing and bearing, I've set myself up. Hopefully you're professionally and financially more comfortable. Now it's time for me. So it can actually be, I think, the best time of your life if you really embrace it. Unfortunately, with the hormonal shifts, there are often physical and emotional discomforts for women. It's often a time when the relationship has had that longevity, when it's a little bit stale, a little bit boring, resentments have built up, no longer the focus on the children. So you start looking at who's this person in my bed and do I want to
That's right.
So once again, there's so much variety and there's potential for freedom and then there's potential for becoming a victim as well.
Oh, what do you mean by that?
Poor me, the children don't come and visit me, my husband doesn't care for me, I don't have enough of this, I can't do this, I have aches and pains, and sort of succumbing to that kind of life is miserable.
Life sucks. Yeah, that's terrible.
And
wow.
Unfortunately, that hormonal shift does not help. Yeah. It is a real thing. And once again, not every woman will have a terrible outcome with menopause, but like there's a bell curve. There's a bell curve. So if you're on the right of the bell curve and you get more symptoms and it's more severe, it does make life miserable. If you're perspiring, during the night and your sleep is disrupted, if you're embarrassed in the daytime, you're talking to a friend over a cup of tea and suddenly you're all with sweat, or you're making love and suddenly, the bed is damp.
I have a solution for that, Margaret. I think you just make love in the pool, Just, go to the local swimming pool.
She is indeed a very foolish person, Margaret. I'm so sorry.
I think it's creative.
So
I think, you've got to work around these things. You've got to make it work for you.
Anywho.
Well, actually, Janet, you've said something absolutely brilliant, and that is that every problem is a potential solution. Every problem, if you can think laterally rather than letting it stump you and stop you, but think, this is happening. I don't like it. I don't want it. How can I think around it to sort of minimize it or compensate for it?
Well, I would like Margaret to tell us how to have sex at a pool, because I do believe that's actually quite tricky.
Really? Why?
Anywho,
have you tried it?
No,
come on. No.
Don't let me. No.
This is, she wasn't born yesterday,
I can tell you, you hold on to something solid, stable.
She's going to tell us. She's going to tell us.
Well, she did. She did just tell us. No, she did just tell us. The other good thing about menopause too, Margaret, and often with other problems, is that they do pass.
Yes.
This too will pass with all of those things. You will, you have to deal with them in certain ways, but also sometimes there's just the, passing of a couple of years.
Well, that's true. For the vast majority of women, the menopausal symptoms pass. There's a small percentage where they don't.
Okay.
Yeah.
Now, the thing to understand there is not to allow negative habits to settle.
Yeah.
So that, when things become uncomfortable and you start avoiding each other and not engaging in regular lovemaking, and I don't mean intercourse there, but I mean lovemaking in the broader sense.
Yeah.
We can talk about that. Then those things become a habit if it's 1, 2, 3, 5 years. And at that point, it becomes really difficult to restart things.
Yeah. It becomes a bit ingrained. Yeah.
It's like set cement. If you think of it, the cement is soft and you can move things around, and then the cement becomes hard and settled, and it's really hard to change behaviours that have been there for years.
I think the key take out of that is don't have sex in cement.
Good idea.
Actually, do you know what I think we should do? I think the other thing that just came out of that was that Margaret mentioned making love. Let's just pause and talk about that.
Let's talk about love.
Let's talk about that. Let's talk about making love and not just having intercourse. Let's talk about the whole making love thing.
Let's not talk about sex.
This is good.
We'll talk about love.
No. I was going to say
making.
it is sex as well. So it's not intercourse, but, let's talk about making love, which is bigger than just intercourse.
Let's think back many, many years, if we can all remember. Can you remember courting?
I know. It was brilliant.
Flirting.
Brilliant.
It was wonderful. You made eye contact.
Yeah.
Your hands touched.
Yeah.
And how did it make you feel? It made you feel like $1 million. It made you feel special, appreciated, valued, liked, desired. That's what I call making love.
Okay.
People get focused on intercourse because biologically that's what nature wants us to do, to reproduce. But most of us are not having reproductive sex. Most of us spend a lot of time trying not to reproduce. What we're having is recreational sex. And what is recreation? Recreation is having fun and having fun with somebody. So what your penis does and what your vagina does is very secondary to recreational lovemaking. And that's the focus that I like my patients to have. Especially in your 40s and 50s. You don't want to have more children.
Yeah.
I know, but of course you do throw a curveball in there, Margaret, because as you and I would both know, you see a lot of people with their husbands post, some sort of prostatic surgery, and they've never had to touch a penis before. And so they're faced with the whole thing of, hang on a tick, do you mean that I need to touch this penis because actually it still feels nice even when it's flaccid? That kind of thing. Talk to us about that.
The guy hasn't touched it or the girl hasn't?
The girl hasn't touched it.
Right.
Yeah.
Oh, okay.
Really? Women don't touch Lots of women don't touch penises.
This is a very odd podcast.
Well, I think that's very generational in Western society and perhaps cultural in societies that don't have much sex education. But there are many people where the job of the husband is to arouse the woman enough to have penetrative sex. Or if he feels that pressure to bring her to orgasm. But the woman is kind of this passive recipient and she doesn't have to do very much. Now, as men become older or if they've had a medical intervention like prostate surgery, then of course they need more stimulation. The penis needs more stimulation to become aroused and to stay aroused. And by that time, the couple have had many years of what I call a sexual script. It's what they do in lovemaking, which has not involved the woman being very active or touching the penis. So women are a bit scared of this foreign entity.
It's true. It's
really
true, Janet. Yes.
That's amazing.
I see it all the time.
Wow.
You don't know what it's going to do. Or you're afraid that you're going to hurt your husband. He's had prostate surgery. It's gone down there, they might do some injury.
This is very weird.
So the most important thing is to learn, to talk, to open yourself up to possibilities and to experiment. You don't have to know the answer at the beginning, but you have to move from where you are. If you stay where you are, then nothing's going to change. So it's about being brave and taking some risks and saying, okay, how about if I touch here? How does it feel? Tell me,
Yeah.
That feels all right. All right.
Exactly. It's his equipment, but yeah.
As long as you're not in the middle of the shopping centre at the time.
I always say, whatever you do in the privacy of your own space with the intention of giving pleasure to each other, that's consensual and that won't get you arrested, is okay with me.
I imagine that actually experimenting is half of the fun. Like if something doesn't work, it's like you can just laugh about it or,
Mind you, people often wound up and distressed, actually, especially as Margaret was saying before, by the time we get 40 plus, we're a bit rusted on in relationships and we have our scripts and it can be quite hard to dislodge people from their scripts.
That's right.
Got to keep an open mind. But so what sort of advice do you have for people as to how to start talking to your partner? Like, you might not have ever had the confidence before to say, actually, this is what I really want, I want you to dress up as a maid and beat me with a feather duster or something like that. But, how do you start to go about those conversations so that you don't need to have an incident with a hairdryer in a bathtub in order to be able to divine what the other person might want,
You're talking about such a big topic here. The reality is most of us don't have good communication skills.
No.
And to have good sexual communication skills in that vacuum is so threatening for people that they rather put up with pain and discomfort and dissatisfaction rather than step over the chasm of fear of actually talking about sexuality. After all, just think back to your family's origin. Did you ever hear your parents negotiate the kind of sex they were having?
No, but I didn't want to know.
No. Well, but you did hear your parents negotiate what they wanted for dinner.
Yeah.
Didn't you?
That's true.
So you learned that skill to take into your relationship. So most of us don't have the language with which to even discuss that, what I want, where I want to be touched. What's that body part called? It's just not down there or your privates.
Yeah.
It's having that whole language. So first of all, you have to have trust in your relationship to make yourself that vulnerable. So if it's a bad relationship, don't even start, because there isn't the trust and the confidence that when you make yourself vulnerable, your partner's not going to ridicule you or use that knowledge in some way. You're not going to make yourself vulnerable like that. So you need to start with a good relationship. It's got to be a good enough relationship to bring up that vulnerable issue of my sexuality, what I want. And if you have that, then it's about broaching it in a general way to see if your partner's on the same page. So it's, I love you dearly and, I want to continue having a good sex life with you. But, things have changed for me since, menopause and after 3 kids and whatever. And I think I might need to change things a little bit or perhaps need different things to make things good for me. Would you be open to that?
I mean, this is where I imagine having someone like you or Dr. Amelia to come and kind of meet with you is kind of a neutral person that you can kind of...
Well, it's a luxury to see Margaret or me, really, isn't it?
But I imagine it just makes it a bit easier in a way because...
Sometimes it does. For because you just sometimes it does.
Have that kind of independent person who can kind of draw that stuff out of you, which, because like you say, habitually you just might not have ever talked about it before.
Yeah. So, one of the starting points when people come to see me is that I use words like vagina and clitoris and penis, and I don't go red in the face or I don't stammer with it, I use those words all day long. And the people think, oh, I haven't died here. Nothing terrible has happened. An earthquake has
no.
And they become more comfortable with talking about it. And you can take that comfort that occurred in my surgery and take it home. And people start talking and finding really their own solutions.
Here we go again.
I have general knowledge about many people. But each woman is unique and each relationship is unique. And, I give that general knowledge and then people find their own unique solutions. And I always say to people, it is so wonderful when you overcome the difficulty you've had, often for many years. You can really feel proud of yourself. And it's such a self-esteem boost for people when they overcome a sexual difficulty. So there's so many benefits from working on sexuality. It gives you that self-esteem, gives you increased confidence and bonding in your relationship. It just increases people's happiness because a good relationship with good sexuality is one of the 3 major aspects of global happiness that people have.
Back to what you were saying about your parents, the other thing is we don't see modelled on TV or in Hollywood very often, like the conversations that people need to have, especially as they age, because everyone thinks of kind of young sex, which, you know, kind of happens almost often without you even having to kind of talk about it or deal with it. But once you're 40, like we're talking about, maybe you're going to actually have to talk about it. And we don't see anything on TV or on the, you know, the big screen that kind of helps us in that space.
Except for Mel Gibson.
No, I was going to say especially not
Mel Gibson.
Mel Gibson. Yeah. Not helpful. Yeah.
You jumped onto one of my pet peeves.
Go. Tell us more. Yeah.
The media and pornography have a lot to answer for.
Yeah.
They teach a really bad model of sexuality that really damages people's potential for enjoyment in sex. You know, I say to people, pornography is adult theatre. It's not how the average person makes love.
It's not reality.
Every day, you know, for 50 years. We wouldn't have the energy. We wouldn't do anything else, you know.
No. It's just another way to feel bad about yourself, really, actually.
Right.
Yeah.
Yes. So most romance, as it's portrayed, is either very cerebral, so it's your hormones, you know, the drive is to have sex as much as you can so that you reproduce. That's nature's desire for us. And it's really, we never really see good role models for people who get into the same bed with the same body, who are aging, who are tired, who are cranky because the laundry wasn't brought in or the dishwasher not empty.
Yeah.
Life.
You know, all of those very normal things that happen in a long relationship are never addressed. So really my message to maturing women and men is always, you've got to change your perspective. You're not making love from a hormonal drive. You're making love because it makes sense to make love to this person.
Yeah.
That sounds fairly cerebral though, Margaret. You know, it sounds like there's no romance in there, you know.
Yes,
sounds like a mind thing, you know.
Look, it's not going to fall out of the tree and hit you on the head. You have to generate the romance. And people to a large extent do, you know, on anniversaries, birthdays, and maybe Christmas. But you can actually do it more often. And the romance might be something as simple as buying a little heart-shaped chocolate and putting it on the pillow. It may be the gentleman going out and buying a nice pair of silk boxes to go to bed in instead of his daggy bonds. It may be going to the restaurant and playing tootsies as well as having a conversation and sipping on your wine.
What about a romantic text?
Romance is what you do. You've got to do something.
Yeah.
You know, whereas when you're very young, it seems seamless.
It does fall out of the tree, basically. Yeah.
But it doesn't when you're 40 and 50 in a 10, 20, 30, 40-year relationship. You have to work on it.
And I think the important thing there too, Margaret, is that it doesn't for anyone. Like if they kind of say to you, but surely we should be able to do all of this without talking, which is what I often get told. Surely it should just kind of come naturally, whatever naturally is, falling out of the tree basically. There's no one out there, no gorgeous person that you can think of. I'm just trying to think of a star who's older, but with no gorgeous star, are they just able to do it, you know, just like that? Like they're all having to do what Margaret's talking about.
Actually do stuff.
Yeah. Actually talk and do stuff.
And work. Yeah. It's work. Romance is work. That's what I'm taking out of this.
Yes.
Well, it sounds like it's just a deliberate thing that you do. You do it more overtly.
That's right. You make the decision that you're going to prioritise your relationship, you're going to prioritise intimacy, you're going to prioritise sexuality, and then you're going to have good sex.
Yes.
So it's a conscious decision. And mostly I ask women, you know, one of the most common statements I get is women come in and say, I'm tired. And I say, oh, okay. So if your mother-in-law was visiting, would you have energy to make a cake?
No.
No. You know nicer people than us. I have no energy for that.
Yeah, you don't make cakes. You buy them, like, right?
Yeah. So it's a choice. Where are you prioritising? Making the effort to go to bed looking attractive? Where are you making the effort to go to bed 15, 20 minutes earlier? To have that sense to wind down, to touch, to caress, to reconnect emotionally so that your body, it makes sense for your bodies to reconnect. So it's a conscious decision through the day. And I have this thing of collecting aphrodisiacs.
Ooh.
So the women look at me a bit blankly and say, well, what do you mean? And I said, well, imagine you get up in the morning and you've got a little shopping basket next to you, one of those booba trolleys. And you have to go through the day collecting aphrodisiacs. So what does that look like? Well, it may look like you're in the shower and you're going to have a 2-minute shower, but for 30 seconds of that, you're going to concentrate on the water running over your breasts. Or you soap your hand and you feel your buttocks or your thighs, your skin, your sensations. It may be, walking past some nice flowers and smelling. It may be hearing a sexual joke and collecting the erotic feelings and putting them in the basket. So the idea is that by the end of the day, sexuality is not a deep frozen thing at the bottom of the list. You may not be horny, but it's actually a possibility. So when your partner comes and gives you the wink and say, well, what about tonight? Although there might be better ways of asking. You say, well, okay, let's give it a go.
Yeah.
So women have that responsibility and also the choice to be receptive.
Yeah. I feel like, and I know Margaret would be with me 100% on this. I was going to say the relationship does need to be in good shape before you start thinking this way. Yeah.
Well, I'll agree and disagree.
Okay, you're allowed to.
It does need to be in good shape for that interpersonal sexuality. But, we're individuals as well.
Yeah.
And if you can't have good sex with somebody else, what about looking after your own sexuality and yourself?
Yeah.
Do you remember the comedian Groucho Marx?
Yep.
Yeah.
He said, masturbation is making love to the person I love best.
Yeah, some good ones.
You've got to love yourself best. And really, religious rulings apart, there's no functional adult that needs to be sexually frustrated if they don't have a partner. And being sexual for a woman with that arousal, with the blood flow going into the pelvic area is very healthy. Having an orgasm with those muscular contractions is very healthy. Having a good, healthy pelvic floor is very important.
Yeah.
But the endorphins and neurotransmitters that are released when you have an orgasm are very healthy for emotional well-being. So if you don't have a partner, if you're a single woman, if your partner is sick or not capable of making love, if your partner is not a desirable partner to make love with, then you can look after yourself. You don't have to miss out because those conditions aren't met. You can meet them for yourself. And it has real emotional and physical benefits for you when you do.
Margaret, what do you think about sex toys? Is that something you would put in that little romance basket during the day, perhaps?
Absolutely. Love sex toys. We are so lucky to be, living at this time because they are so beautiful.
Aren't they
those
gorgeous?
Lovely sensual colours, that lovely sensual medical grade silicone that they come.
Some of them are attractive and some of them aren't. But anyway, continue.
No, I had to.
I'm only talking about the attractive ones.
Yeah.
So one of the things that maturing and menopause does for women is that it decreases sensual awareness, the sensual perception. So, for instance, if the smell of your partner used to turn you on as part of that package of becoming aroused, and menopause has changed your sense of smell and you're no longer getting that arousal factor from the smell of your partner, then you're going to be missing out. And that can happen, for instance, the sense of touch. So often after menopause, the sense of touch is different for women. So where before, if a light touch is to get you very aroused, and now a light touch is like
not going to cut
an insect crawling over your skin, it doesn't have the same impact.
Yeah.
And what toys do is they increase the stimulation you're getting in a much shorter time. So that it really helps that arousal process along, and it really helps that ability to reach orgasm sooner and faster. And you can use them by yourself as well for variety. And variety is one of the components that I think sex toys bring into the relationship. And sex toys for men and for women. You know, you get a little bit of titillation, a little bit of anxiety about something new. Oh, what will this be like? Will I like it? You know, the surprise, element of surprise that you bought a toy and something new to bring into this lovemaking for your partner, or that your partner has surprised you with a new toy. So I think toys are a very integral part of good lovemaking, because for the first time, you've got to think that we're wanting a good sexual monogamous relationship for up to 60 years or so now.
Yes.
So Toys R Us.
Toys R Us.
That's unprecedented in historical times.
Yes.
You know, women died in their 20s of childbirth. Men died of infections and accidents. People didn't live so long, didn't stay married to one person for 60 years. And we want sexuality to be fun.
Yeah, it's funny because I was Googling, sex toys, just research. But then I realised I was on my work computer and, and I know they monitor, the search habits of everybody.
Right.
So, so I don't know how I'm going. I'll refer them to you, Dr. Margaret. Is that okay?
Oh, good.
Toys R Us. I thought I was looking at Toys R Us, but I was toys, so different kinds. Some of them are very pretty
foolish.
and they're very easy, low maintenance. You can just hose them down and all that sort of stuff.
Yes. It's true. I think, not so long ago, 20 or 30 years ago, it was just so outrageous to even think about sex toys. Like it was
a bit icky, wasn't it?
Totally icky, I think. With those people who are listening to this and kind of thinking, oh, but they're so disgusting. There are the disgusting ones. There truly are. But then there are, as Margaret said, really beautiful ones.
They are pink, purple, green.
Well, actually more than that. Ones that I always say, Margaret, that ones that look like Norwegian remote control. Do you know what I mean?
No, I didn't look at that one.
Beautiful Scandinavian design.
IKEA.
George Jensen. No, George Jensen. Awesome. Yeah.
No, Alan Key.
They do. They look very organic shape. You could actually almost arrange them like a table decoration.
Yes. Yeah,
maybe you should.
You could invite some people over for dinner and just it could be in the middle of the table and, you could just pretend that they're, ornaments.
Well, there's also another artist, Brancusi, and his sculptures are very organic like that and look like sex toys as well.
They are.
Dr. Margaret, a question for you. So say you haven't had sex for a very long time, perhaps a relationship broke down and suddenly you do start having sex again. How can you kind of stay healthy, sexually healthy after perhaps
How can you reignite the female genitalia? Is that what you're asking?
And not catch some sort of horrible disease as well, because, you might just be dating.
Okay, so you brought in two issues here. So we know that the highest risk of STIs are among the second and third rounders. And that's because, we think of condoms as to be used for contraception, not for STI prevention. And also because if I've been monogamous, then I anticipate the other person's also like me and monogamous. And that's not necessarily the case. Maturing older people are having more sex and are having more partners. And it's really important to protect yourself, not to rely on the other person to protect you.
They're forgetting to protect themselves.
Yeah, good advice.
Now, the first question you raised was if, for instance, you've lost your partner and you've been celibate for a long time and you've masturbated by external stimulation of the clitoris, which is how mostly women will masturbate. So then your vagina, chances are, has shrunken. It's become more fragile and thinner in the tissues. And sudden penetration is going to be painful. You're going to create little paper cuts which are going to sting. So you don't want to do that. So if you've not had penetrative sexual activity for a long time, then it's really important to start gently and perhaps using your little pinky finger with a lot of lubrication to just gently stretch the tissue. Get it used to that.
Janet was just demonstrating it visually. Yeah, carry on.
Not
Margaret.
entirely, but just a piece of it.
Yeah. And you can, or if you don't want to use your hand, you can get very thin, they call dilators, lots of lubricant, and gently retrain your vagina to be pliable and to accept that stretch, which is going to be required with intercourse or even finger penetration. A man will have a larger finger than you will, Chancellor. So to go slowly, but lots and lots of lubricant. Now, if you've not had HRT.
The vaginal opening. There used to be a joke when I was at uni, Margaret. So many decades ago now. And the boys used to say to the girls who were virgins in particular, "You better use it soon, otherwise it'll grow over. It'll close up." I think it's important for people to realise that doesn't actually happen. The tissues of the genitals are very responsive. So certainly, even on the other side of menopause, like using things, and Margaret uses things like this too with her patients, like Ovestin and not to mention brand names, but anyway, so a kind of a pessary that can go inside the vagina and actually make the tissues respond.
What are you talking about? Hang on. What's a pessary?
Oh,
come on.
Evans, pessaries.
Tell me.
Actually, I believe the French love pessaries. The French love pessaries.
A pessoir.
Yeah. So a pessary can be used basically, it can be used in the anus as well.
It's
you can put Panadol into your body. You don't have to swallow it. You can actually put it in your anal cavity. So a pessary is it's the same thing with the vagina, that you just place a small, tablet that breaks up within the vaginal cavity. But anyway, over to Margaret, because she knows all of this too.
See, I did not know that was a thing. That's very interesting.
So if you find that gentle, regular exercise with a lubricant is not enough, then it's really important to go and see your GP and get a topical estrogen cream, which can be a cream, it can be a pessary, that will replump and rejuvenate the wall of the vagina. Okay?
Wow.
Replump.
I want a replump vagina, please.
There you go. Yes.
Rejuvenate that vagina. So that, you can do your exercise more easily and get that pliability and stretch back again. I often say to my women, and it's not only the women who are single, but if I asked you to sit in your chair for a week and then get up, what would you be like? Would you? Yet somehow we think that we should be able to put our vaginas on the shelf for a week, a month, 3 months, a year, and then take them down and use them. Now, they get rusty. So the most important thing after menopause is regularity of sexual and penetrative activity. That's the best way to help slow down or prevent the aging of your vagina, as it were. Regular sexual penetrative activity.
You too can have a designer vagina.
Or a plumped one.
No. A designer vagina is different.
Oh, is it? What's a design? Tell us.
I want women, whatever their natural vagina is, I want it to be healthy.
Okay.
They don't have to have one that's a specific diameter, a specific length that looks, with the labial lips are a specific design and size. You don't need any of that. Just need what you have to be functionally healthy. Because ultimately, how your vaginal opening looks is only important if you're going to have pictures taken for porn magazines or whatever magazines. They don't have magazines anymore. That's my age talking.
If you're going to have a website of your vagina.
What is important is how your genitals feel. What messages they're capable of receiving, what pleasure they give to the partner. So it's functionally how you're working. The looks are not so important. So we don't need designer bodies.
I think I was thinking the designer vagina was actually just the healthy vagina. But Margaret's got a good point.
No, but there is the designer vaginas on the wall of Mona. Have you been to Mona? There's
I have.
There's a clitoris. Actually, it's a clitoris wall.
But they're not designer ladies. They're actual moulds from real women.
They're art.
Yeah, they're normal.
It's art.
They're normal.
Yeah. And it's fascinating to see the diversity. It's fascinating.
Exactly.
Well,
it's good for us all.
I like the fact that you call it art Because there are cultures in the world that celebrate women's labia as art, as beautiful flowers with petals and different shapes and design. And we don't all have to look the same. Yeah. We can all look different as long as we're functionally healthy. And to keep that health, it's about keeping that vaginal tissue pliable, lubricated, exercise the pelvic floor muscles.
And plump.
Yeah, and make love in a good context.
Wise words.
Oh, Dr. Margaret, to wind up, just if there was a top tip, what would it be from you for maintaining healthy sexual relationships and just making the most of this time of our lives well into our 60s, 70s, 80s, 90s and 100s.
Yes.
You want a one-word answer here?
Just a one-word answer, please.
No. A one soundbite answer.
One soundbite. Respect yourself.
Oh.
Yeah, nice.
Very good. Yes. We'll get Aretha to finish this podcast for us. Respect. R-E-S-P-E-C-T.
Yes.
Yeah, I think so.
Absolutely. We'll bring it on. Thank you ever so much, Margaret. That has been, that was like a good meal. I feel that podcast was a good meal.
Wow. Okay.
Yes, don't you think, for women 40 plus?
Yes, I think so.
Nice.
It was delicious. There was a lot in there, except for oysters. There were no oysters in that aphrodisiac basket. But, if your husband came home and brought you half a dozen, that might be good.
Yeah.
I think occasionally, this episode just went off track a little bit, but...
No, it didn't.
No, it didn't. No, it didn't. No, it didn't. No. But Dr. Margaret, thank you so much for lending us your wisdom and your experience on about what women really, 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 really want.
Pleasure. I enjoyed it.
Gorgi, thanks for listening in today. We hope you enjoyed this ep.
But we'd really love to hear more from you. We'd love to know exactly what you actually think of us and our guests.
So if you're on Spotify, you can rate us. We love stars. And on Apple Pods, write us a little blurb. Let us know what you think and hopefully we can keep going. Apple loves their algorithms and we love you. So thanks for listening. We really enjoy your company.
See you next week on She Wasn't Born Yesterday.
Hope 1032. Thanks for listening.